This is Jennifer Cook. This is the airway obstruction video for an adult, and at the end I'll tell the difference for a child. This begins just like regular CPR. You check the scene for safety and for any type of clues. You confirm if the victim is responsive or unresponsive. If the victim is responsive, you stay with them, call 911, and wait until an EMT arrives. If they are unresponsive, then you continue with normal CPR procedures for an unconscious victim, which is you gently shake them and ask if they're okay. If they're not responsive, then you check for any type of severe bleeding or any type of neck or back injuries that you can see. You send bystanders to call 911 and get an AED first aid kit if possible. And then you go into CPR. You have your gloves. Your body is positioned directly over the victim. You check with the hand closest to the feet for the xiphoid process. It's about 2 fingers right above that is where you put your palm. Interlace your fingers. Start with chest compressions. Your shoulders should be lined up directly over the victim. And it's about at least 2 inches compressions, 30 compressions in about 18 seconds. 1, 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10, and 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 23, 24, 25, 26, 27, 28, 29, 30. You use the barrier, pinch the nose, do head tilt, give 2 slow breaths. 1, 2. If the chest does not rise, you reposition the head again, give 1 more breath. The chest didn't rise again, so I go back to my 30 chest compressions. Interlace fingers, 1, 2, and 3, and 4, and 5, and 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 22, 23, 24, 25, 26, 27, 28, 29, 30. This time I open the victim's mouth and I see if I can see anything. I do, so I'm going to do a finger sweep with my index finger and hook around the object. I'm going to take it out. I'm going to put my face shield, pinch the nose, head tilt, 2 breaths, watching the chest to rise. This time the chest did rise, so I go back to my 30 compressions and to continue to do this until the victim becomes conscious. An AED arrives, an eye tire, an EMT arrives, or other assistance, or the scene becomes unsafe. The difference for a child is the same thing for an adult, still checking the airway with the finger sweep and thumb. And then the chest compressions, though, are about 2 inches, so not quite as deep as with an adult. But all the other procedures should be the same.